It's time for Checkup with Dr. G.
Once again, it's time to check up with Dr. G, Dr. Michael Garver with Premier Care Pediatrics. Why is it important that women who discover they're pregnant start getting into the process of choosing a pediatrician at an early age?
Art, that's a good question. I think that one of the things, especially with first-time mothers, is that oftentimes pediatrics and finding a pediatrician is somewhat of an afterthought. They get so absorbed with their OB visits and the baby and how the baby's developing, is that sometimes the last thing they focus on is trying to find a pediatrician. We do prenatal tours here, which is something that I've always loved doing, is sitting down with new parents and talking to them about what to expect in the hospital, what happens afterwards, and we've always had a commitment to help those parents, one with lactation help, so breastfeeding help, and we have a certified lactation counselor here, Carlin, who's the nurse practitioner. We also have...
Let's just step backwards a little bit on the lactation program. Why is that important?
Well, one of the things is that people oftentimes make that seem like a very easy and natural process to promote breastfeeding. And what we find here is that in actual practice, it's not quite so easy. And mothers obviously are under a lot of pressure and a lot of stress, and it's a difficult process, and so they have a lot of questions. And one of them is that they're taking care of their baby adequately, and are they getting enough nutrition? And so we want to make sure that we see them early and that we provide that kind of support.
And actually breastfeeding is scientifically proven, medically proven, that this is a very good thing for your child.
Well, among that, there are medical advantages, but and also emotional advantages and bonding. But at the same time, it's very cost-effective, and formula and other forms of nutrition are expensive.
Now, you do have a nurse practitioner on staff, and how does that fit in with the overall scope of your office?
Carlin is actually a provider here, and she and I are a very good team and have a very similar philosophy and work together well. Oftentimes having a female provider in your office allows people to choose, and whether they want to have a female or a male provider, that just opens things up for us.
Perfect. Now, the other thing that you hear a lot is that you are like always on call. What's that all about?
I know that people are surprised by that, but one of the things that I do is my commitment to my patients is to be accessible. And that's why we have the late evening clinics for healthy and sick children. And then the 24/7 call works to where they can reach me by telephone, so that if they have any concerns or worries, that we can actually provide the reassurance that people need.
And I imagine you can answer quite a few questions over the phone too. You don't have to come in and have an office call.
You're exactly right. It's those questions can be answered in just a matter of a few minutes.
All right. If I'm new to Great Falls, what's a landmark close to you, and where do we find you?
Well, if you go down 9th Street, and we're right near OBGYN Associates, so I would say that 916 13th Avenue South, call us at 770-3000 and schedule an appointment.
You've been watching Checkup with Dr. G.